There by Kathleen.
So there's a whole interventional suite there, which we'll go through and you'll see.
But we had spoken about mainly focusing on public areas for this
Right.
initiative, right?
So we're going to show you where patients come in.
Right, so let's start, and we have to.
So what happens is patients actually enter through this area. Stretchers come in through this area for CT, for ultrasound, and for X-ray.
I'm sorry.
Just want to let him know
Patients
that
are
there's a
here in
patient.
this stretcher area. Radiography is these two rooms, and RNF are the two rooms to the left.
Back a little bit.
We
so
have
you
two
can just-
ultrasound rooms on this side. So ultrasound and X-ray on this side. And then CT is around the bend where there's two CT scanners and two additional scanners. So the clinical hub is here. Patients are first in this general. And I'll show you interventional on the other side.
So where do patients enter over here?
Yes, let me show you. This is the patient hallway. As you can see, this is not for staff. This is not for the public. Patients come down from the floor on a separate elevator, and then they are brought in through this hallway, which is private for patients. It gives them a lot more dignity. And in radiology, they go in either through here or here. Generally, they go in through here for CT, for X-ray, and for ultrasound. And they go in through those double doors, which I can show you later, for interventional radiology.
And we're putting artwork in this?
We're putting artwork in here, not in this area.
Not in this area.
Not in this area. No, that's a public area. This is
That's not
radiology.
Explain it to me.
Everything off this corridor is of a clinical nature. So there's the lab behind me. There are several portals that are used by radiology, one further down on this side by cardiology, so that this really is not in and of itself a public thoroughfare.
That's it, and we wanted to feel like it's sort of, behind the scenes, so it's not
Okay.
supposed to feel so welcoming, so people don't get lost. They come in through the portals, the public portals that they're supposed to come in through. But on the second floor, we're going to change some pathways up there, and we'll have this will become a more public corridor too, and that'll be our next one.
Because this is a nice...
It is nice.
It's a nice place to hang.
Right, well,
But it's a nice place for patients to be dignified when they're going down here in a respirator or intubated with 5 tubes in them. They're not walking with the public.
Right.
So this is actually a phenomenal kind of approach to patient care. That I come from Mount Sinai, where there was a single thoroughfare on the main floor, and you could have children and adults walking in plain clothes right next to someone that was intubated with 10 tubes in them, completely undignified. So this is fabulous
Okay, so
for patients.
in
Patient experience.
terms of the artwork for patients, in here, wait, Dr. Lefkowitz, stay with me a
I'm with
little
you,
bit.
I'm with you.
Okay, so the point of having the artwork in that interior is what?
Patients spend
Look
time.
at him.
Patients spend time here waiting, and patients are moved into these rooms. They spend time in the department itself before they're X-rayed
And the
after
artwork?
they're X-rayed. And the artwork would be in this general area so that patients
And the
can,
purpose of the artwork?
is for patients to feel more comfortable. It's for patients to feel a sense of warmth from the artwork. It's to beautify the space itself. That's my perception of
talk about the
artwork.
acuity of our patients and why the stress level and things, like why art is important to the level of acuity.
So patients come here,
Look at Jen.
yeah, many patients come here with acute illnesses, severe chronic illnesses, and they get imaging to help diagnose their illness. Many patients come down here who are in severe distress, and the imaging is critical before life-saving treatment is provided. So coming here and seeing the artwork, feeling comfortable here is very, very important to us. And that's, especially since the new construction was completed, it's an ideal place to really place beautiful artwork. Okay, now, when they go into interventional, which is down the hall, they're coming in for actual procedures. Not just for diagnostic imaging testing, but for actual invasive
Do
procedures.
they wait a long time in
And
this
they
corridor?
they generally don't wait a great deal of time. The goal is always to keep their waits down to a minimum. But in interventional procedures, they sometimes have to, after the procedure is done, they have to be monitored, or For certain types of procedures, they may be down for hours. So again, having artwork in that area as well, I think will help calm the patient and make it feel like a very warm, welcoming environment. Those are generally our sickest patients are the ones going to intervention.
So when they're looking at the artwork, they're not thinking about the tubes and
The tubes, the lines, the pain, the discomfort, and many of them have very serious illnesses. So again, we want to really create an environment that's optimized for many of our sickest patients.
Okay.
In
other words, as we go down the corridor, you stay here.
Okay. In green is ultrasound, it's color coded. That's right, the color coded is ultrasound. And here is all CT. So there are 2 CT rooms and a control room. You can see how happy we are. We have Acrovin, so this washes off as compared to having to be repainted.
Now, this
Acrovin
stuff
is-
we can't,
We can't go into this.
we're going to have to figure something out about that. You can see that, again, if this was not Acrovin, this would be.
what do you think?
See, you
Like
I'm
if
here,
you
the
have a
system,
stereo,
yep.
would that be okay for this space? Because, well, it's not gonna be the same.
As long as, we just have to look at the depth of the handrail to make sure that we.
Yeah, we would make sure that anything was framed slimline so that it won't hang out. I'm just worried about if we're suspending,
They're all on locks, they can't fall down.
okay,
And so even if they were to get, I mean, that's a transport hallway out there, and we've
Right.
never lost one of those pieces.
Okay.
And they're not as narrow as what I think you're envisioning.
yeah, okay.
So I think we'd be okay. So what she's saying is they'll all be suspended.
I understand because of the Acrovin.
Mhm.
Yeah.
That's why I mentioned the Acrovin to start with, because it's
But what are you
different
thinking
type of
about it?
surface.
Yeah, I think we'd have to do a sky rail, like the way that they've done it in the hallway.
But you're okay with that?
Dozens of patients come through here every day.
No, we're talking about how to hang the work. And we need to put a sky rail on top of this. so
To be
that-
able to hang it.
Right.
It'd be
Yeah.
So they'll be
fine.
suspended,
It'd be fine.
just like it is in the main tower, on the main hallway out here. But I think it'll be better because I think it's narrow. Or if they're gonna do it narrow.
Yeah,
Right, we don't got a lot to, have a lot to work with.
And now this equipment here,
We keep this equipment here in case there is a code for a patient. And that's why the equipment is kept here in the hallway. And on the right side is, keep this enclosed space, as you can see, to keep patients hanging.
Well, I think in this
These are all
hallway,
Acrovin.
we talked about,
Yeah.
that's the wall you were talking about.
Right.
Because we thought there would be no
are we gonna do
burning traffic.
anything on these walls?
I don't know, what, did you have it in your
in
proposal?
the initial proposal, this
do.
was a wall that we had designated.
Just let's show Dr. Lupton.
So there
So
was.
that's green.
Yeah, there was a green, were any of these green at one point?
No.
Okay,
No.
so it must have been on the other
But
side.
that's okay.
That was the staging area on the other side.
No, that's,
I think
Is that
we're
this
right
wall?
here.
that's right here.
That's what you're looking at
That's
it
this
right now.
wall right here.
Yeah, yeah.
Okay, that's looking this way.
Yeah, that's exactly right.
So you're talking about this piece, right behind Dr. Lupton.
Right. And actually on
And that's
that
this
wall
piece right here.
It's gorgeous.
would work.
And it actually is very nice because of the floor over here
Mhm.
too.
The green.
This would be up here.
Yeah.
Really lovely.
And we had an alternative suggestion would be two pieces, but looking at the panel,
I think one
I think
middle
one-
would be.
I think the color works better on this one for this hallway.
Yeah.
and then we had looked at a few different things for the end here, which was some of these works.
Which are fun.
Sort of
I don't know if it
recreation.
should look more natural. Are you thinking more?
I'm
these are the
thinking,
pieces where
yeah, I'm thinking that if you're gonna have this, this
Here.
area, that should all be
Similar.
similar, whereas something like that can go, it'd match very well with blue,
Right.
the blues, right?
So what about this piece? At the
Yeah,
end down
and
here?
also match, these two would go along very, very well.
So this is 20
That's
by 40.
how I perceive that would be over there.
This
and-
one, right?
Well, the thing, because we're
We
probably
can do
going to have to
size.
do prints, we can base the sizes
Got it.
based on the space. So
Great.
that was the other reason why we wanted to,
Right.
firm up the locations.
Absolutely.
But I think this is very pretty.
It's gorgeous.
For the end of the hall.
Yes,
Plus there's
yes.
a road, right? It kind of.
Gives you a whole different feeling.
Right.